During this session, which will last approximately 40 minutes, we will review the steps required to line and prime the Surdial X in order to do an online hemodialysis therapy, otherwise known as DIF. DIF stands for Dialysate Infusion Function. This means that the Surdial X can utilize dialysate to prime, bolus and reinfuse during treatment. We'll have a look at the specifics of how DIF actually works when the machine is priming. The supplies required for this session are the Surdial X HD DIF lines, the Nipro cart, the prescribed acid concentrate and the Alisio dialyzer. It's important to note that the Alisio dialyzer is the only one that is approved for use for the HD DIF function. Once the machine powers up, there are two options available on the screen: treatment mode or cleaning mode. We're going to select treatment mode in order to begin the preparation. We're then going to follow the instructions in the guidance box. It's important to note that any instruction, alarm or reset option will always and only be in the guidance area, so please do follow that very carefully step by step in order to perform the treatment correctly and safely. The first thing we're going to do, as shown in the guidance box, is connect the A nozzle to the concentrate. This is done by moving it from 12 o'clock to 10 o'clock and placing it in the canister. Once that's done, the machine automatically tells us the next step, which is please install a B cartridge and press the reset button to start priming. So I'm going to prepare my Nipro cart. Just take the caps off top and bottom. Open the cart arms, pull them towards you. Just place it nice and gently in the bottom first, and then this should fit in nice and snugly. It doesn't have to click, just nice and snug. And then very important to remember to press the reset button in order to move to the next step. Once the reset button has been pressed, the startup test will begin. This will take just over 4 minutes. Once that is done, the machine will then automatically start preparing the dialysate in order for us to be able to prime the machine. I'm going to go ahead and open up the HD DIF lines, and there's a little notch at the top where I can tear them open really easily. These can be placed on the tray, and also inside the package is a sterile cap that it's really important to keep because we're going to use that once the prime is finished. I start with the arterial line, and I tend not to take all the tapes off initially, just so the lines don't drop and potentially hit the floor. I'm going to open the arterial pump door, and if you look at the segment, there is only one correct way that it can be inserted. The easiest way to remember is that at the very bottom it looks like little teeth, and inside the pump there's actually indentation where they sit, and the most important thing is that these are inserted first. So pop them in there, and then I'm going to give it a gentle nudge, and then with my thumb I'm going to push until I hear an audible chime and a click. If the pump segment is incorrectly, I automatically see a picture of the arterial and venous lines on my screen. The picture on the screen is a really good way to ensure that the lines are placed correctly. Depending on the therapy, the picture of the line placement will change accordingly. Once I've closed the door, I can undo the tape, and I'm going to follow the picture on the screen to help me place the lines correctly. I'm going to ensure that I come around this holder here. Very important not to skip that and do this. Let's come around the holder, put them in here nice and safe and secure. It's really important that all of these holders are utilized because we like to have our lines as still as possible during treatment. Right below the single needle double pump, if applicable, is your BVN module, which doesn't need any additional or alternate lines or calibration before we start. So we just open the door with the clip. Ensure that the line is placed in nice and secure, and that you can hear an audible click to ensure it's closed. Then we come down to the arterial clamp. Again, pop that in and make sure you hear an audible click, and they're both closed. Attached to the arterial blood line is the arterial sensor, which, as you can see, is a very different visible thickness to the arterial blood line itself. On the end of that is the little sensor wheel, so we take off the sterile cap and attach it nice and securely. It's a lure lock connection to the arterial sensor. We don't close the clamp because the rule of thumb is we only close what we're not going to use. So on this particular arterial blood line, we're going to close the heparin clamp, and we're going to also close the infusion port down here, just to make sure there are no leaks. So always clamp what you're not going to use. I'm going to leave the bloodline clamp open, and then just to anchor it, we're going to go ahead and place it onto the dialyzer holder. The next thing I'm going to do is attach the short portion of the arterial bloodline to the dialyzer. It's important to follow the line placement screen to make sure it's done correctly. Putting it in front of the expansion chamber holder would be incorrect, as it causes a major kink here. So it's important to come around the right hand side of it and put it in where the line is anchored, nice and securely, and then attach my bloodline to my dialyzer, making sure it's as tight as it possibly can go. Now we're going to move on to the venous line, and a good thing to do is before you actually pick it up, just tighten where the overflow line connection is, because sometimes it can come a little loose during sterilization. Now we're going to place the venous chamber into the holder. So you pop it in like this, make sure it's nice and snug, and that it's sitting firmly into the holder itself to make sure the pressures are read correctly. Then I'm going to go ahead and attach my sensor and my line to the dialyzer. So I see the one with the little wheel, the sensor line. I'm going to pop it on here. It's a nice blur lock connection to the venous sensor. Again, that clamp is left open because we're going to be using it during treatment. I'm going to undo my tape now. And then I'm going to find the line that I know has to go to the dialyzer with the large connection on the end, which is this one. So I'm going to just place it behind the sensor line and make sure it's held in position with the anchor here along with the arterial line. And now what I'm going to go ahead and I'm going to attach my venous line to the dialyzer. So I'm just going to pop it around to make it easier. Take the cap off. And again, just like the arterial one, this should be put on as tight can be to prevent air sneaking in, and because sometimes when they're warm they loosen up a little bit during treatment, so there should be little or no gap at all. Okay, let's go back the way we were. As I come down then, I pop the venous blood line into the venous clamp, which is the air detector and blood detector, making sure that snaps shut nicely. If I look at the end of the venous line, I can see that there's a little protection extension on there. And the purpose of it is that for a saline or a HDF prime, we would place, because it would be instructed on the video, to put the venous line into the drain port. So in order to protect the venous line before it's connected to the patient to maintain its sterility, this portion is always disconnected. So this never ever goes to the patient. But in this instance, if I look at my screen, I can see we're not putting the venous line into the drain port because we're in HD mode, but it shows me clearly that the arterial and venous go together. So because this is a protection extension and it's not going into the venous port, I want to dispose of it prior to priming so that way it never gets near the patient or the risk of connection. So I'm going to connect my arterial and venous together. So I'm just going to go ahead and take off the venous extension that I don't need. Open up the arterial and put the two together nice and securely. And what I'm going to do, I can hang them either here on the heparin line, or sometimes I just hang them down here in the bottom, just to make sure that they don't hang on the floor. Now that the startup test and dialysate preparation are complete, which took us approximately 8.5 minutes, all the lines and dialyzer are correctly in position, the machine lets me know it's ready to prime. It displays this long message across the screen in the guidance box, and it says, please connect both dialyzer couplers to the dialyzer and keep the blue coupler on the bottom. As we can see in the picture, the blue end is up in the screen, but this is when we're priming the blood circuit side. But for priming the dialyzer, we specifically put the blue coupler on the bottom because the dialysate is going to prime from the blue coupler in an upwards direction to get rid of all the gas and push out the air. Now I'm going to attach the red and blue couplers as instructed on the screen. It doesn't matter which one you put on first, as long as the blue one is on the bottom. That clicks into place, and then we do the blue one. Also just click that into place. Once the couplers come off the black sensors and they are attached, a message is displayed on the screen, and it says, Are the dialyzer couplers connected to the dialyzer? If so, press the OK button to start the dialyzer filling process and fill up the dialyzer completely. The next instruction is please fill up the dialyzer completely and then press the priming button. So we're going to visualize the dialyzer, and what we look for is ensuring that the outside compartment gets primed, and we should see the fluid coming out the red coupler. So please turn the dialyzer so the blue is on top, and mine is. And we advise to keep the Alicio blue on top during treatment because it helps to get rid of a lot more air as long as the connections are nice and tight. So mine's already blue on top. So I'm going to select the priming button, and as soon as I do that, we'll see that the pump automatically self-loads. So it's a self-loading and self-ejecting pump. And as soon as that is done, it's then going to start checking the connections, and then it'll proceed on to the DLC. So I've selected the priming button, and once I do that, I see that the priming screen is displayed here on the left-hand side. These are preset values, and it tells me my rinse and priming volume is 1000 mils. It's going to take 6 minutes and 40 seconds at a rate of 150 mils per minute, and I'll be able to see here the progress of my prime. I can see in the type of priming, it's directed towards dialysate option because it's green. That's automatic because we're in the DLC and DIF therapy. In the guidance box, then I see a couple of instructions, which is really like a safety checklist before we start the treatment. So we must read all of them, and then once we've confirmed them, we press OK and we can proceed with the prime. The first instruction is connect the arterial blood line to the venous line, and we have that done. Open the drain port and connect the overflow line to the drain port. So I have done that, but it's reminding me just in case I hadn't. Please make sure that the patient is not connected, because obviously we haven't primed the lines, so we should never connect the patient until the patient connect button is actually selected. Once I've checked that all those are correct, I select OK. Once the pump is loaded, the guidance box will display priming starts automatically after dialyzer leak checking, or DLC. As you can see, the DLC/DIF is on, and DIF again stands for dialysate infusion function. So what happens when the dialysate infusion function is on, the priming solution of dialysate comes directly from the blue coupler, and it's pushed across the membrane of the dialyzer, up through the venous bloodline, down into the venous chamber, and because the arterial and venous line are connected, it's a completely closed, continuous circuit or prime. While that's going on, to ensure that the prime itself is drained effectively, this is what the overflow line is for. So as the machine is priming with the dialysate, it's then getting rid of the priming solution through the overflow line, down through the drain, and out through the back of the machine. During prime, you can monitor the progress by looking at your priming screen on the left-hand side. And also, just to note, the pump speed will ramp up to 400 during the prime to help dispel the air. Additionally, we could also assist with getting rid of the air by gentle tapping occasionally and ensuring that all the air is gone prior to connecting the patient. Once the priming is complete, the Surdial X will automatically go into recirculation eco mode, meaning that the pump speed will be reduced to 50, and if we look in the dialysate menu, we'll see that the dialysate flow is 100. This way it will conserve the concentrates. Whenever I am ready to connect the patient, the two main screens that do need to be addressed are dialysate, which we're in now, ensuring we have the correct concentrate and we have the Nipro cart, that our default settings of sodium, bicarbonate and the temperature are correct. The UF menu, this is where we input our time and our goal. If the goal isn't entered when the machine detects blood and the treatment is started, the machine will remind us that no, your parameters are entered. So we'll pop in our goal. Once that's done, again, I'm going to ensure if my patient is ready, read the instructions, rinse volume reached. To connect the patient, please stop the blood pump. So we're going to go ahead and do as it says, stop our pump. I'm going to go back to my home screen, which is the blood circuit screen. It just allows me to see everything. Once I stop the pump, then I've got three options. I can continue priming, If I think that maybe there's some air in the circuit, or I just would like to get more dialysate flowing through the circuit, I can put the machine back into eco circulation if I'm not quite ready to connect, or I can select patient connect. The most important thing is that we don't connect any lines to the patient until this patient connect is selected, and we follow the subsequent instructions, because the air bubble detector is not armed until the patient connect button is selected. So right before I finally select the patient connection, it's always good and do a quick safety check following the ABC. A is making sure that there's no visible air in the lines. B, making sure all the blood lines are in correct position. And C are the connections, making sure all the connections are secure and we're ready to go. So I'm going to tell the machine I would like to connect the patient. So I select patient connect, and then the overflow line starts to empty. Close the clamp on the venous chamber towards the overflow line. Close the drain port, so I'm going to remove the other end of the overflow line from the drain port and close it. Sterile package, and I put those two together, making sure it is a sterile cap. You'll notice that once I close the drain port, I have an OK available. If the drain port is left open, there will be no OK, and therefore you can't proceed. Connect the arterial line and venous line to the patient. So, as we would, and obviously we have the correct PPE. I will get my lines ready. Clamp, clamp, and we'll connect to our patient. While the patient's blood is priming the circuit, it's a good idea to drop the level of the venous chamber at this point, because the level always ends very high because it's a closed circuit prime under a lot of pressure. We're going to use a venous chamber level adjuster. Simply press and hold it down until it drops to where we want it to be, which ideally is right at the indentation that you can physically feel and see on the venous chamber itself. If it's too low, it can cause problems because the blood has a long way to fall and can cause a lot of turbulence and unnecessary air bubble alarms. Once we've acknowledged blood detected and both lines were connected, the pump will automatically start and the machine puts itself immediately in treatment mode. There's nothing additional we have to select or push. The machine also verifies that it's in HD treatment in the top left-hand corner. Now I can start increasing my pump speed as I normally would for this specific patient, and at the same time I can also monitor my arterial and venous pressures to ensure they're within safe limits. 5 minutes into the treatment, the UF stop button will always be solid green and the light on top of the machine will flash. This is the time when the machine is calculating the TMP. Once the machine goes into treatment, it's always a good idea to double check our parameters. Let's first go to the UF menu. I can confirm I've set the time and the goal correctly. Then the dialysate menu, confirm that we've got the correct acid and the Nipro cart. I see that my default parameters are where I want them to be. Anything I want to change, I can just select that particular one and go up or down on the digit and change it to as prescribed. So if I want to change my dialysate flow, I can do that here. Because I've changed the flow, I can see that the UF stop button is a solid green and the light is flashing on the machine. This means that the treatment has stopped momentarily while it adjusts for the dialysate flow change. The important thing to note is that any time the bypass or the UF stop are solid green, the machine is doing something that it needs to do in order to continue with the treatment as prescribed. If the patient is feeling unwell and you manually select the UF stop, the green light will flash, but as you can see, the UF stop button will flash between green, blue, green, blue. So the difference is when the machine is doing something internally, the UF stop button will be solid green. When you select it manually, the UF stop button alternates between blue and green, and the only way to take it out of the UF stop is to manually select it again, and the machine then will continue to remove fluid as prescribed. So during the treatment, when in the blood circuit screen, I've selected it so that's green. I can monitor the patient's arterial venous pressures here. I can monitor my TMP and my conductivity values. I can at any time go into any of the menus and decide I would like to change a specific parameter, increase or decrease at any time. I can also change the time, adjust it up or down, anytime I like during the treatment. As long as when you change the value, that you always press enter, it will be saved. Going back to if your patient's feeling unwell and you want to stop the fluid immediately, we select the UF stop button, and then the next step is usually to administer a bolus. This can be found in the online menu. You select your bolus, the button turns green, and it monitors the volume given. The bolus comes directly from the blue coupler, across the dialyzer, up through the venous line, down to the venous chamber and directly into the patient, so it's very quickly administered. And that is the dialysate infusion function, where the dialysate comes directly from the blue coupler to be used for priming, bolusing and reinfusion. The volume and the rate of the bolus can be set to any specific default that is the policy and protocol of your unit. Moving down the action keys, we can see that the first aid button says 3 seconds and off. The reason why it says that is that being a touchscreen machine, it wants to make sure you don't press it by accident or just brush against it. So we want you to press and hold specifically for 3 seconds. So 1, 2, 3, and the machine will do 3 things. It will drop the pump speed, it will stop the UF, and it will begin to take the patient's blood pressure. And obviously, because we've had a sudden drop in the blood flow rate, it's going to potentially trigger a venous pressure minimum alarm. When we look down on the bottom in the guidance box, we see that the machine is telling us that the first aid function is activated. Please check the bypass, UF rate, blood flow and settings. So if I go to the UF menu, I'm going to see that the UF rate and the goal has stopped where it had achieved the 0.8 and the rate has gone to 0. So it's telling me to check. Again, it's just alarming because my pump is low and obviously this isn't a real patient. Or would you like to go back to previous settings? So your patient has recovered, you've probably gone online, potentially given a bolus, your patient's recovered, and now would you like to go back to the previous treatment settings? Once I say yes, it goes back exactly where it was before, to the same blood pump speed and the same goal. Same time, and it just carries on treatment as prescribed. Going further down in the activity keys, the heparin option is the next one. This is where we would enter the flow rate, our stop time and pump on, and we are going to have a look at this and how it functions and how I load the syringe in a different instruction. If you would like to check the patient's blood pressure at any time, I would just go ahead and select the BPM, and as you can see, it starts taking automatically. If I wanted to stop it for whatever reason, just go ahead and select it again. The system option is where all the settings are that the technicians use, so therefore we don't need to review those. The last button on the right hand side is the function option. It has a couple of functions here: BPM blood pressure monitor, dose finder, dose detector, the timer and BVM. We're going to look at 2, 3, 4 and 5 during a different instructional video, but the one we do need to look at now is BPM, number 1, and this is where we can set a time interval for the machine to take the patient's blood pressure. It's always defaulted to off, and you can go right or left to select the interval that you want. Down here are where the clinical parameters are for our blood pressure readings and pulse. Right now, if the systolic blood pressure dropped below 80 or above 200, it would appear in the BPM box in red, and it would give us an audible and visual warning in red in the guidance box. It would say systolic, check systolic low or systolic high, etc. The pump wouldn't stop and the therapy would continue, but it will keep alarming until you address it because it's out of the parameter windows. If I would like to actually link my treatment and how that functions with the parameter readings, I can, let's assume that this is my patient's first treatment and I would like to know if their systolic goes below, say, 110. Always remember to press it again to save it. And I would like to know if the systolic goes above, let's say something like 180. Again, save it. I can change any of these also. Obviously, I would like my pulse to be quite a bit lower. So I want to know if my pulse goes above, say, 80 or below 50. So now I've set the specific parameters for this particular patient. Now I'd like not just only for it to alarm if it goes below 110 or above 180 in red and let me know. I would like to link it so it's going to do a specific action. I simply then turn on the link. I select which one I want the machine to monitor and link the therapy with. I'm going to select systolic and pulse. And that means it's going to follow this algorithm. And the algorithm is that I don't want the machine to go into bypass if the systolic or the pulse go below or above the parameters selected, because then I won't be able to give my online bolus. But I would like the machine to automatically go to minimal UF, because it could be an indication that the patient is getting hypovolemic, and I do want the blood pump speed to drop to 100. You can alternatively say, I don't mind if the pump speed stays where it was or at any specific value. You can change that. But by linking any of these with your treatment condition, when it comes out of any of those parameters, not only will it show up in red and alarm, it will then automatically go into this mode, which is almost identical to first aid mode. And it will tell you, just like we saw on the first aid option has been activated. So this is a really nice tool and a very safe tool for those patients who are unstable and you can't be standing by them as often as you would like. The machine will notify you if the patient is out of safe clinical parameters and will stop removing fluid. There is also a quick off button over here on the right hand side that in the case of the emergency and a patient has the cuff on, if you select quick off, it'll take the blood pressure, stop, take the blood pressure, stop. So it just repeatedly takes the blood pressure over and over. And then the good thing is that in the data screen, any blood pressures that have been taken at any time before and during the treatment will be listed here in this box. So they'll always be recordable. And remember that you'll always have 4 treatments on hand for all the data and any results of the blood pressures. Of no alarms or activity, a nice screensaver comes up. It's nice and bright, very visual, and you can see it from quite a distance as well. If we look at the screen, we can see the patient's arterial pressure, venous pressure. Their last blood pressure would be sitting here if we'd just taken it. The remaining time of the treatment, the start time and the end time. This is something that patients really like to see. Then in the 3 dials we have the UF goal. The goal is set at 2 litres. We can see how much has been removed, it counts drop by drop. And it's like a speedometer that goes across the circle once it achieves the goal. At the very top is the blood flow, and over here is the UF rate. So obviously we're taking off 2 litres in 4 hours. This is the rate per hour. So it's a really nice visual for the patients to see when they're on the machine and for the nurses to be able to see when they walk by. And to get out of this and back into the main information area, you just press anywhere on the screen, and then again after 1 minute of no alarms or not touching it, the screensaver will come back on by itself. The last thing we'll look at is the reinfusion option. If the patient needs to come off the machine early and we need to reinfuse immediately, we just simply directly go to reinfusion and follow the instructions that are displayed at the end of every treatment. When the machine has finished the treatment, it will play a little audible tune. There's a couple to select from. Nice tune. If you'd like to do your reinfusion in silence, you can just go ahead and mute the end treatment tune. So, the option we see is exactly what we saw if we were going to take the patient off earlier. The machine asks us, would you like to stop treatment? Yes, we do. We select that. Now we see that the priming button has become the reinfusion button, and the priming screen has become the reinfusion screen. The reinfusion volume can be set to whatever default you normally use in your clinic. It tells me how long the reinfusion is going to take and the rate, and I can see the progress of my reinfusion down here. In the type of solution I want to use for reinfusion, I have 2 options. I obviously have dialysate because we're online, but normal saline is there also if I came to the machine and just at that moment in time, maybe the concentrate became empty or it ran out of bicarb because it was a very long treatment. So therefore we would have the option to use saline. We'll go ahead and do a saline prime and reinfusion in another teaching session. So right now we're going to read what it says on the screen. Select the type of reinfusion or press the treatment button to go back to the treatment process. This second step means that if I'm just about to take a patient off and there's a potential emergency in the next bed, I can just press treatment button and I'll go back to where it was. Obviously we've achieved our goal. So we'll go to reinfusion. Would you like to stop treatment? Yes, I would. Select the type of reinfusion. So the type I'm going to select is dialysate. I select dialysate, it turns green, and the pump stops. So the instructions say, please disconnect the arterial blood line from the patient and connect it to the venous drip chamber. So let me go ahead and do that. So I'm disconnecting my patient. So I've disconnected my arterial line from the patient, and I of course would have my PPE on. So I take off my little cap and then put those two together, making sure that's nice and secure. The next step says, and close the arterial pressure line by the clamp. So the arterial pressure line is right here, and the machine tells us to close it, because what we're going to see is when reinfusion starts, the pump goes from moving anti-clockwise to clockwise. So therefore we don't want to suck up any potential air into the circuit. It looks a little unusual having the arterial line go to the venous chamber, but it's because we always need to bring the arterial line to wherever the reinfusion fluid is. And in this instance, we're using the DIF, dialysate infusion function, so the reinfusion fluid is coming directly from the blue coupler. It's being pushed across the membrane, through the venous blood line, down into the venous chamber. So because this is where the reinfusion solution is coming from, we bring the arterial line over to that. Also, we have to have some way for the blood on the arterial side to go through the air bubble detector. And this is why at the very beginning of treatment, when we removed the overflow line, we replaced a sterile cap on there. So I've done those instructions. I'm going to say OK. The next instruction is please make sure the clamps on the arterial line and venous line are open. So open this one and then my patient arterial line. Once I've done that, tell the machine I've done it, OK. Always remember to do the action first and then select OK. Because if I just read it and press OK, the pump will start without me having done the action. So read your action, do it, OK. Now the pump starts, and what happens is the arterial blood pump turns clockwise to bring the blood from the arterial side into the venous chamber, and that is flowing at 75 mils per minute. At the same time, because we're using the dialysate infusion function, the dialysate is pushing it across the membrane through the venous blood line and down into the venous chamber at an additional 75 mils per minute. So altogether, the patient is receiving the reinfusion fluid at 150 mils per minute. So the pump speed up here is reflecting the pump speed from the arterial blood pump and from the blue coupler. So this is your cumulative total. That's usually quite a standard. You can increase if you want, but this is the default recommended. So the blood is pumping from the arterial side into the venous chamber, and everything's going back through the air bubble detector, nice and safely. I can see the progress of my reinfusion. I can say I've had enough, the patient's had enough, we're going to stop that now. I can see I've given 177 mils. I can say I'm going to drop that to 200 and continue. I can then decide to continue again. I can change this volume up or down to what I ever want it to be at any time. It looks like it's going really, really slowly, and it is, because we're only seeing 75 mils of speed here, and we don't visualize the additional 75 mils coming from this side. But it is infusing at 150 mils per minute. Now my reinfusion is complete. I can check the patient's blood pressure, or I can be satisfied with that reinfusion. If I wanted to give more, I can just select reinfusion continue, and it always starts with an additional default of 100 mils per minute. I can also stop that at any time. Okay? So I'm satisfied with my reinfusion volume. I'm now going to remove lines. And when you decide you're going to remove lines, I always take that as, let me remove the patient, let's disconnect the patient before we do that. So we're going to disconnect our lovely patient back here, clamp the venous clamp, and we can just place that line anywhere I usually pop it on the heparin line because it's just ready and available. I'm not using it. So now, the machine asks me what I want to do. I'd like to remove lines, but it's very forgiving and it gives you one more chance in case right now the patient feels unwell. You could go immediately back and give some more reinfusion. But thankfully my patient's fine. I'm going to remove lines. So now we have some instructions that's going to help us put the machine into disinfection, and it's important to follow them step by step. Please turn the dialyzer so that the blue coupler is on top. Mine is already there. Remove the blue coupler from the dialyzer and connect it to the socket. So I'm just going to unclip it and go ahead and put it on the blue coupler on the side, remembering that it has to hit the black sensor at the side of the machine, and once it hits the black sensor, the message will change. So the next message is, the dialyzer has been emptied, and when the dialyzer is empty, please connect the red coupler. While it's draining the dialyzer, which only takes a few seconds, I normally just go ahead and strip the machine, because that's a few seconds I have free, and I usually start from left to right, just because it all comes off really nicely. Take off this line. As you can see, once I open the pump just slips out like this, no problem. So now, once I've gotten over to this side of the machine, obviously I have my PPE on without a doubt, it tells me to remove the red coupler from the dialyzer and connect it to the coupler socket. Take that off. No drips, all dry. Again, place it on the side of the machine, and when it hits the sensor, the message will change. And it'll immediately go to the cleaning screen. So the last step that the machine is going to do is going to drain the bicart completely empty, so there's no leakages when we go ahead and throw it away. So now it tells me to please remove the empty B cartridge and close the arms. So I'm going to remove the Nipro cart. So I lift up the top portion, and it's always good to try and take it out gently, lifting it upwards, because sometimes if you pull it to the side, it can bend the O-ring. So just take it out nice and gently. Close both arms. They must be closed. If they're left open, the machine won't go into clean. The machine is now telling me that in order to start cleaning, please close the B cartridge holders, they're closed. The dialyzer couplers, they're both on. The sub and the drain ports, which are closed, and the A and the B concentrate suction tubes. So the last one I have to put back is the acid concentrate. So I remove it from the canister, open up the flap, and go from 10 o'clock to 12 o'clock. Once everything's replaced as it's supposed to be, the machine then will tell us we have to do a mandatory disinfection. And you can reset and reset, but it is not going to go away until the disinfection is done, even if you turn the machine off and on. So we're going to select hot disinfection, and we're going to select start to get the disinfection going. It displays the temperature fluctuation during the hot disinfection itself, the fact that it's going to last 31 minutes. And if I'm not going to use the machine again for the rest of the day, I can select auto off now, and as soon as it is done 31 minutes, the machine will automatically turn itself off. The nice thing as well, which is a big bonus, is that all the treatment information is going to sit here while the machine is disinfecting. I know that with many machines it disappears straight away, but it's going to sit here for a full 31 minutes. We have the time to write down our UF volume, our UF time, if we have been doing HDF, the substitution volume, the litres of blood processed, and the blood pressure, mean and pulse. Again, as a quick review, under data, we can also see the same information that is stored in the current treatment. It even tells us the start and the stop time. It tells us everything we need to know, even down to the serial number of the machine. So that's under data. So now you can take care of your patient, ensure they leave the unit safely.
That was fine.
So now the treatment has completely ended, and you continue. So now the treatment has completely ended, the machine is cleaning, and you can take care of your patient. Thank you.